I know you've been publishing a series of dispatches in the age of COVID-19. We've got two of them on the Bloomberg terminal. And the common theme you identify here is the lack of data we have on the virus, which is stunning given that we rely on data to drive so much of everything that we care about. The optimal results of everything from political campaigns to baseball teams to supply chains. In this case, though, we're flying blind. You, however, did find someone who has a novel way of thinking about how we can collect and apply the data. You spoke with the former chief risk officer of J.P. Morgan. Tell us what you learned from him.
So his name is Peter Jackson, and Peter Hancock. And Peter Hancock he had a very bright idea. He saw this letter that two leading British ENT specialists published a few days ago, explaining just how prevalent this odd symptom was with the coronavirus. And it was a symptom of loss of sense of smell. And it's really dramatic. I mean, it's like you don't just sort of lose your sense of smell, like you wake up one day and you can't smell an onion. And they're seeing it, in just a shocking number of the cases. And they've done some work with other doctors around the world. They're working on a paper that they're about to publish, I think, in the Journal of American Medicine, where they're trying to figure out, what percentage of these people who've got coronavirus also lose their sense of smell. And it's somewhere between 30 and 60%. And they've estimated that like 80% of the people who lose their sense of smell right now probably have the virus. So it suggests two things, and they suggested two things to Peter Hancock. One was you can use this as a very crude self-diagnostic tool that if that's all that happens to you, isolate. I mean, it's a symptom that happens to kind of be a leading symptom too, and a symptom that occurs when no other symptoms occur. But the second thing was, he said, my God, we can harvest this as data. If we get enough people self-reporting that they've lost their sense of smell, it might give us a map of where the virus is, but that we can't get now because we don't have the testing kits. And so it was a really interesting idea. And the thing that impressed me so much is I talked to him the last couple of days to write this little piece that I published today on Bloomberg, but he got on to the British doctors. He himself is English. The day they published their letter, 5 or 6 days ago, and in 5 or 6 days, he's built this organization, complete with data scientists and a website and celebrities who are going to encourage people to report their sense of smell. I think it actually offers a real, I mean, it's crude, but better than anything we got, sense of like where this thing is. And you can't really fight it unless you know where it is.
Right. And of course, he's doing this as we try to search for some kind of medical solution to figure out who is sick or who perhaps has immunity to coronavirus. What's interesting, too, is that he's looking for people to help him crowdsource this. I mean, he's looking for influencers to try to get the word out. Do you have any indication whether how much traction this has gotten?
Well, just judging from the response to the piece, it's going to get a lot of traction. And I mean, he's just created the website yesterday. So I mean, this has all happened in the last 5 or 6 days. Smart people seem to think this is, including the British ENT specialists, this is actually a really good idea. So it's like a situation where absent the test. I mean, if we had widespread, kind of universal, cheap testing, you wouldn't need this. But his point is even more interesting than this. That, look, in the United States, in a month, maybe we'll all have widespread testing. But what's going to happen in India with 1.3 billion people? Are they ever going to have this sort of testing? So it may be the point is it's cheap. It's like a free diagnostic tool, a free way to get a population kind of wide map of the disease. And the couple things that are really important here. One is that because it's an early symptom, and because it's often just a lone symptom, you get it with people who are otherwise asymptomatic, who are exactly the kind of people who are going to be walking around otherwise infecting people. And right now, he points out, rightly, who's getting the test? The people who are getting the test are the people who are showing up really sick at triage tents outside of hospitals. And those people already are going to be isolating. The people who are really dangerous right now, the people who don't know they have it. And this is a way to identify that you might have it. So I think, it's a little, as I say, this is all being done on the fly, but he has a lot of very credible people, I think, including the World Health Organization, on board. And so I have every, I think it's every possibility that this thing could move very quickly.